Several years ago, I woke up one day and my neck hurt. And I thought, oh, I just slept wrong. It's not the end of the world, it will go away. And 2 months later, it hadn't gone away. So I start going to chiropractors, physical therapy, trying to figure out what it is. X-ray showed it was fine, but it started getting worse and worse.
Lyme disease is a vector-borne illness. If I can use really simplified terms, it's a small cork-screwed shaped creature that gets into your body. It changes shapes, it hides easily, so sometimes you can run tests and it doesn't show up, but that doesn't mean it's not there.
A couple months down the road, pain moved to the front of my head. Couldn't explain what it was. Went to ENT doctors thinking maybe the front of the head pain and the neck pain didn't have anything to do with each other. Had a couple nose surgeries, went from doctor, and no one really had an idea.
Lyme disease is known as the great imitator. And because of the fact that people get misdiagnosed, I know personally of many people who were diagnosed with other conditions for years and put on medications and spent thousands and thousands of dollars when they really had Lyme disease.
They thought, okay, well, we'll give you this migraine medicine, and after 3 tries of this migraine medicine, it didn't do anything but make it worse, and the doctors were really puzzled then. And with none of them being able to figure out what to do, I ended up at my last resort, a chiropractor, and she sent me to a holistic practitioner in the area, and she says, I think you need to be tested for, just see what she can come up with. And I will never forget that phone call. It was late at night phone call from the lady, and she says, I think you have Lyme disease. And it was a eye-opening night. Don't just take the first answer. Don't just take what someone tells you have or what you think you might have, but there's more in this world, and it's just finding someone that knows what could help you.
Well, one of the most common and the one that people think of most often is the bullseye rash. Unfortunately, upwards of 50% of the people who get bit by something carrying Lyme disease don't ever manifest with a rash. Other symptoms include severe headaches, neck pain, jaw pain. These are the things that I had because I'm a Lyme survivor.
Yes, it can come from a tick, and I believe it can come from any tick. It also can come from other bugs.
That's what most people think, that it's only ticks that transmit Lyme, but many of the Lyme literate specialists believe that there are other things that can contribute to it: mosquitoes, biting flies, some forms of fleas.
And I believe it can come through sexually transmitted or through birth. It can go through breast milk. It can be through blood transfusions.
If you get bit and you have the Lyme, the typical rash, and you get on a course of antibiotics right away, many times people can recover just fine. However, for many of us, we didn't know we were even bitten and didn't have the bullseye rash, so we had what became, is known in the Lyme littered circles as chronic Lyme. And in that case, it's very hard to completely eliminate it. It's not cut and dried. Every case of Lyme disease is different.
General doctors have a lot of their own, thoughts and feelings on Lyme disease, but they're definitely not the best people, and I think they would be the first to tell you that they're not the best people to go to for Lyme disease, that you really need to go to a Lyme literate physician, someone who has had the training specifically from another doctor who has practiced Lyme medicine.
I was fortunate that when I started having all my problems and I didn't feel like I was getting the results from my regular doctor, whom I liked very much, but I just wasn't getting the answers that I needed. I knew something was wrong, so I did find a Lyme literate doctor who did put me on antibiotics, and I was on antibiotics for 4 months. But along with that, I made dietary changes. I went on an anti-inflammatory diet. I took a number of supplements to support my immune system, because when your body is working so hard to fight this infection, your immune system is compromised.
Whatever method would work. We would try something new every single month, whether it be supplements or other forms of treatment or antibiotics. We were able to juggle it back and forth and use both methods.
There are a number of protocols that Lyme literate doctors will follow with their patients to help them recover.
Just antibiotics alone usually aren't going to be sufficient, and it really depends on the person. I have met people who have done just antibiotics alone, but they've noted that they had liver failure, or they've had other issues, or they've had a lot of what we call Herxheimer reactions, which are actually symptoms may appear worse for a while as you're killing off the disease.
We really need to have the government and the medical community be more supportive of chronic Lyme issues, and there needs to be more funding, more research.
I think everyone that has Lyme disease, just spreading the word, especially telling your friends, people that trust you, that know you, that know what you've been going through, because then they spread the word and they say, I know someone who has this and you're having some of the same symptoms, maybe you have Lyme disease, because that's one thing that has helped me through the years.
I would want to encourage anyone with Lyme, first of all, not to give up. It's very hard. Many people with Lyme disease are told it's all in their heads. It's that it's not real, that they really have something else, and so to do their own research, to study, to connect with other Lyme survivors so that they have a network of people to keep going, because life is worth living.
There's many times that I just wanted to give up and say that whatever was wrong with me didn't exist. And even when I found out that I had Lyme, and my doctor, who I valued and trust, passed away, I wanted to give up, because what else am I going to do? But never give up. No matter what anyone tells you, you can feel better, and you can help others along the way.